Filtering in, just so you know, we're going to be recording today and sending this to different churches up in Fairbanks and down in Homer who are helping with VBS and camp. But the primary audience is you, and we're so glad you're here today. This kind of came out of a need for, basically, people have voiced when they're at VBS or in Bible class or camp, they have really challenging experiences and interactions with kids, primarily ones they don't know very well, and they can sense something else is going on that they're not equipped to help with. And this hasn't been one person saying this, it's been a number of people. It's been me as a parent of a child who is not considered typical, and a child I have to give special instructions for. And so a few of you have said, I wish I had better tools to help kids that just aren't what I'm used to or who I don't know. And this is more than children with disability. Every child has emotions, big emotions just like us, but they don't always have the language to articulate it. And so it's up to us to develop the skill set to help them navigate their experience. So the first person that came to mind was Tyler Williams. He'll talk more about his experience and his credentials, but Tyler is Addie's husband first. That's the most important part of him. But Tyler is a pediatric occupational therapist. He has 3 children of his own, and he is extremely calm and level-headed and well thought out with children. And you can see that just any interaction when he's with kids. And I knew that he would be an excellent resource for this to help us learn. He's also a Christian, which is significant. He cares deeply about children spiritually and eternally when he interacts with them. So we're really excited for him to be here. And we'd love to invite you to come on up, start talking.
All right, is this mic working? Good? Okay. So, as Amber said, my name is Tyler Williams. I'm an occupational therapist. I've been working with pediatrics for the past 5 years. I'm currently working with a company called Therapeutic Health and Home, which is a mobile therapy clinic to, sorry, I forgot to, got to get used to this. There we go. That would be great, thank you. We're a mobile therapy clinic, so we go see people in their homes or community to treat them, and that's children and adults, so all ages. But I specifically specialize with working with children to develop social and emotional learning, behavioral regulation, and sensory integration. And we'll talk a lot about all those things today. So, yes, okay. So I got my master's in occupational therapy at University of Alabama in Birmingham, and then before that at Freed-Hardeman for my bachelor's. Just a little background of me. I forgot to add, Amber already said, husband to Addie. So, and 3 wonderful children, James, Lainey, and Lauren. So, also, as Amber mentioned, the purpose of today, equipping volunteers to better understand and support all of our children and youth as we navigate challenging behaviors. So, specifically in the context of ministry, so most, if not all of you here are involved in some form of church ministry, whether it's VBS or camps or just Bible classes or anything in between. But all of the topics we'll cover can be applied to any area of daily life. So, and then the key idea that I want to make clear is behavior is communication, and our goal is connection, not control. So, just a quick outline of some of the things we'll be talking about. First, we'll cover what challenging behaviors are, and why certain kids struggle with those challenging behaviors, and then how we can respond to these challenging behaviors. So, we'll start with what are challenging behaviors. So, I'm sure all of you are familiar with the phrase temper tantrum, especially if any of you had kids or been around kids for a minute. So one thing that I want to make clear is they're very similar, as you can see on the slide, both can look very similar. Screaming, kicking, shouting, stomping, those kind of behaviors can apply to both of these. But where we differentiate with temper tantrums and meltdowns, tantrums are driven by want. Well, I'll go with the order that's on there. Never mind, sorry. Had it backwards on mine. Meltdowns are driven by a reaction or something within the environment, sensory or otherwise. They're a reaction to overloaded sensory system or feeling of being overwhelmed. They don't care if they're getting attention or not. The child is lacking all control. They're unaware of their behaviors. And they'll continue even without an audience. There's no goal for their behaviors. They'll only cease once they've calmed down or helped to regain control. And the opposite of that with the temper tantrums, it's typically driven by a want or a goal. It's usually because they want something, and if they'll often check in with you to see if you are paying attention. If someone is throwing things or stomping their feet or whatever, they'll give a little side eye and look and make sure you're okay. Or if you walk away, they'll come follow you and continue their behavior and throw themselves on the floor, that kind of thing. The child is aware of their behaviors. They want to be in front of an audience so that their behaviors are seen. And then typically, once they get what they want, the behaviors will cease. So I want to make clear that tantrums are typical, normal part of development. Any kid can experience those. The challenge becomes when it turns into like a learned behavior where they learn, oh, I get what I want whenever I I start throwing things, or when I start screaming, mom gives me what I want, or I get some candy if I start screaming. And then they learn that if they keep doing that, then they'll get whatever behavior or whatever reward. And typically it's the parent not wanting to either deal with whatever negative behavior, or maybe in like some kind of social setting where it's like, this is too embarrassing, I'm just going to give it to them. I don't want other people looking at me, that kind of thing. So that can become a problem if it's a learned behavior where they try to get what they want, and then but again, the harder part is to identify whether they're seeking some kind of reward or have some kind of goal, or if it's just completely out of their control for a meltdown. So, okay. So, how behaviors may appear. So, some of the things, just kind of broad, withdrawal or avoidance, and that can look like not engaging in activities or ignoring. It could be eloping, so running away from the teacher or classroom or whatever. Could be defiance, so like not following directions or arguing, testing boundaries, those kind of things. Could be difficulty with transitions, and that could be either toward non-preferred activities, things they don't want to do, or away from things they do want to do. Sometimes transitions are really hard for both of those. So it could be intense emotional reactions, and this can be both physical and verbal. So things like hitting, kicking, yelling, screaming, those kind of things. So restlessness or inattention. So this could be impaired attention, direction following, struggling with initiating tasks or finishing tasks. It could be difficulty sitting still or remaining in the chair or at the table or wherever. And then also unusual communication or social interactions. So this could look like not playing or interacting with others, minimal to no responses to instructions or questions. And then a big important part I want us to all remember is that a lack of communication does not equal a lack of understanding. Just because a kid may not respond doesn't mean they're not hearing and understanding what you're saying. A lot of times that's kind of hard, especially with children with developmental disorders, and you try to speak to them like they're a lot younger than they are and kind of oversimplify things in a hurtful way. If they're cognitively there just because they can't respond, it's kind of demeaning and it can be hurtful to that individual. So, I want to talk a little bit about why some kids struggle with challenging behaviors. I apologize. I'm going to take a drink of water real quick. So, I want us to first keep in mind that this is not an exhaustive list. These are just a few common diagnoses that we might experience, and also clarifying that just because an individual has these certain diagnoses, that does not indicate that they will display challenging behaviors. So just want to keep that in mind, that these are common diagnoses that we often see struggling more often or more likely to experience these. So we'll just go quickly through some of these and give a brief description of each of them. So many of these diagnoses would fall under the term neurodivergent, which basically means that their brain develops or works differently than a typically developing brain. And then that can result in certain strengths or struggles compared to a typically developing child. So the first one on the list, autism spectrum disorder. So this is a neurodevelopmental disorder characterized by differences in social communication and interaction, need for predictability and structure, possible sensory processing differences, highly focused interests, and then repetitive behaviors, which also can include stimming, and we'll talk a little bit about that later. And then a big important part of that is the spectrum part. No kid with autism is the same. There's currently 3 different levels of autism, level 1, 2, and 3. So 1 would be the most mild, where they require some support. Level 2 is they require substantial support, and then level 3 is requiring very substantial support. So within those 3 levels, there is also varying degrees. And then there's a quote from Dr. Stephen Shore: if you've met one person with autism, you've met one person with autism. So just having a diagnosis does not categorize you into one specific thing. So our next one is ADHD, so attention deficit hyperactivity disorder. So this is a developmental disorder characterized by an ongoing pattern of one or more of these following symptoms: inattention, hyperactivity, or impulsivity. So inattention could be things like having difficulty paying attention, staying on task, or staying organized. Hyperactivity could be things like moving around constantly, typically at inappropriate times, feeling restless or talking excessively. And then impulsivity, such as interrupting or intruding on others, difficulty waiting turns, things like that. Down syndrome is also known as trisomy 21. It's a genetic disorder of the presence of a 3rd copy of chromosome 21. So usually associated with developmental delays, mild to moderate intellectual disabilities, and then characteristic physical features. Some of those may be like low muscle tone, so like really weak, or poor fine motor or gross motor skills. They may be really discoordinated, things like that. It can also lead to like speech delays and things like that, just from the musculature and low tone. The next one is sensory processing disorder. So this is a condition where the brain has trouble receiving or responding to information that comes through the senses. So your 5 main senses: sight, smell, sound, taste, touch, as well as some lesser known sensory systems: vestibular, proprioception, and interoception. And we'll talk more about those later. Intellectual disability. This is a condition affecting cognition and adaptive functioning, so things like learning, problem solving, judgment, struggles with daily life activities like communication, social participation, things like that. Learning disabilities, these can be things that you may be familiar with, like dyslexia, so trouble like reading, interpreting letters and words. It could be struggles with understanding verbal instructions, reading comprehension, dysgraphia, which has to do with the ability to write, and then dyscalculia, which has to do with numbers and math-related skills. And then other mental health conditions, we won't get into too many of these in depth, but some big ones are anxiety, depression, obsessive compulsive disorder, post-traumatic stress disorder, and then other mood disorders. So, I want to talk a little bit about some demographics that we may experience or have kids that are dealing with difficult life situations. Many people, especially in Alaska, are involved in the foster care system. Alaska has one of the highest percentage of children in the foster care system in the U.S. And then many children are in the foster care system because of challenges with abuse or trauma, mental health conditions with either them or their parents, and other challenges surrounding that. Dealing with divorce and separated parents, living in poverty, substance abuse either with the child or the parent, history of abuse or trauma. So a big point in this is when we're interacting with these kids, there is often a lot going on in the background that we are unaware of, and just keeping that in mind when we're interacting with these kids, just knowing, just kind of empathize with them that they might be going through something, and that might be kind of the cause of what's going on at that moment. So just keeping that in mind is important. So some common causes or triggers of behaviors. So sensory processing issues, I want to talk a little bit about sensory seeking and sensory sensitive or avoiding. So back when we talked about the sensory systems, so the 5 main ones, touch, smell, taste, hearing, and sight. So some people struggle with how they interpret that and respond to that. So some things like auditory sensory processing, where they're more maybe they are more sensitive to loud noises, or maybe they enjoy really loud noises. It could be two extremes. So either they seek really loud music or are constantly talking because they like being loud, or maybe they're the complete opposite. They want to be away from the crowds because it's too loud or too overwhelming. Things like visual skills. It could be that they are overwhelmed with pictures on the wall, or over too many things going on around and they're easily distracted, or maybe they highly focus on one visual thing and can't seem to move away from that to focus on other things. Some things that might be a little bit more common are with touch, so things like constantly touching other people, or maybe even avoiding crowds and avoiding social games because they really don't like touching or engaging with other people. This can also impact daily life skills like tolerating clothing that might feel too itchy or too tight, or so that those kind of things might be a cause of a meltdown. Is I can't figure out what's going on. Maybe their just clothes are too tight. Maybe they got their hands messy and they can't tolerate that they're overwhelmed and something like that. So vestibular. So the vestibular system, it contributes to balance and orientation in space. So it tells us about movement and position of your head relative to gravity. So these 3 on that last bullet point there are going to be some that you're probably most likely to notice like kids struggling with. So vestibular could look like so for sensory seeking, they could be constantly moving, difficulty sitting still, constantly rocking or bouncing or jumping. It could also present as like a risk taker, an unsafe child, where they're constantly wanting to like seek that thrill of jumping off of things or running through the hallways or wherever. And then again, the opposite of that with the sensory avoiding, they might not like movement and they might have a hard time like playing with activities or engaging in like play equipment or other kind of movement activities. So they may be more avoiding of that. So proprioception is your sense of position, location, orientation, and movement of the body. So you have different receptors in your muscles and joints that tell you where your body is. And so someone who struggles with your proprioceptive system may frequently bump into others or crash into other people. They may enjoy like really rough play. They may have a hard time knowing where their body is and interact too rough with other people because they don't get that feedback of how aggressive they're being. So these could be kids that are constantly pushing and shoving and crashing into things like that. So interoception. So this is a sense that allows us to notice internal body signals, and our body uses those signals as clues to develop our emotions, and then has to do with a lot of emotions and feelings like hunger, thirst, pain, body temperature, sleepiness, anger, anxiety, sadness, need to use the restroom, things like that. So if someone is struggling with that, they may not understand what those internal body signals are, and they might not be able to respond appropriately. So sometimes a kid has a meltdown, but the solution is, hey, they just need to drink water. They need a snack, or maybe they're tired. Something like that can be, so it can be some simple things, but they just have a hard time understanding what is going on within their body. So other things that can be causes of behaviors could be being asked to engage in a challenging or non-preferred task or activity. So this could be possibly because of like negative self-confidence. They either don't believe in themselves, they don't have high self-esteem, they maybe have tried before and failed too many times and they just avoid it. Or maybe they've been made fun of because they are not good at something, and so they just tend to avoid challenging things. Also, being told to do something that you don't want to do kind of give children a feeling of a lack of control, and that can also be related to like a child with poor tolerance for being told no. So they are told no, they don't feel like they're in control of anything, and so sometimes that can lead to some behavioral reactions. So unpredictable routines or transitions, again, back to the desire for control, structure, understanding expectations. Sometimes it's like kids don't understand time. It's a hard concept. So knowing like, hey, we're gonna go do this thing in 15 minutes. It's like, I don't know how long that is. So we'll talk about some tools to help with that later. But just knowing that they might not understand what the expectations are. They may be surprised by a transition. I thought I had more time with this fun thing, and you're telling me all out of nowhere, probably not, but out of nowhere that I have to leave it, or I just don't know what to expect. And sometimes that can look like a kid constantly nagging you to ask, like, what are we doing next? What are we doing next? So giving some kind of routine. And then also some social demands. So this can lead to embarrassment if a kid has a hard time with social skills. It can also be related to different personality types, like being an introvert versus extrovert. Some kids want to engage more with others, and some kids don't, and so that can play a lot into how well somebody is engaging in an activity, and also related behaviors because of those social demands. So I want us to, in those situations, try asking yourself, what is the behavior telling me? So trying to problem solve versus attempting to control the situation, and then also focusing on regulation prior to task completion. So we're going to talk a little bit about how to respond to challenging behaviors. I'm going to pause again real quick. Excuse me. So the first section, some tools and strategies for dealing with challenging behaviors, has to do with communication and connection. So some important points is to use clear and concrete language, trying not to give too many instructions or too big of words, simplify things, make it easy to understand, but then also allowing additional time for kids to respond. We talked a little bit about some learning disabilities, having trouble understanding verbal or visual instructions, things like that. So giving some extra time. Sometimes if you ask a question and don't get a response immediately, you ask it again, and that just kind of overwhelms them. They're trying to process it the first time, and then they're not able to respond because you're interrupting their thoughts. But being aware of your tone, being calm and not trying to match their energy. When a kid escalates, you don't need to match their escalation and get into a yelling match. You set the tone. Hey, we're going to be calm. We're going to be talking like this. Okay? So, using certain language like, it's time to do this, instead of are you ready to go? It's like, no, I'm not ready to go. If you give them the opportunity to say no, they're going to say no. So, it's time to do this, or we're going to do this. Things like that. So, validate feelings and then redirect. So, kids have feelings too. And their feelings are just as valid as ours. When they have big emotions, they're real emotions. So validating those emotions, saying, hey, I understand you're angry at this. I would be too. Let's try doing this. Or, hey, I'm sorry that happened to you. Do you want to try doing this instead? But making the child feel validated in their emotion, trying to avoid statements like, it's okay, that's not a big deal, don't worry about it, because then that kind of tells them oh, I'm wrong, my feelings aren't important, that kind of thing. So another point with communication is to use visuals. So most all of us are visual learners, and especially people who have a harder time with understanding verbal instructions. Visuals are a great tool. So this could be things like schedules, timers. You can use a visual timer. They have apps on your phone, or little visual timers that spin around, and then it'll beep when you get done. That can help people understand time, understanding when transitions are coming up, or the schedules, knowing, hey, after this, we're going to do my favorite thing, or I need to do a couple things, and then we're going to do something really fun, or something like that. So first then, so that's kind of a simplified way of using language or visuals with your schedule. So just when too many instructions, if you give a list of your entire day, that might be overwhelming for some people, most people. But if you say, first we're going to do this, then we're going to do this. And that could be on a card, that could be me holding up my hands like this, then this. First we're going to go take a bath, then we're going to go play out on the something. Sorry, that was a bad example. So either that could be helping with transitions to or away from preferred or non-preferred things, especially. But it just gives some simplified language, and then also could be some visuals with understanding like transitions and routines and things like that. So some sensory and emotional supports. Excuse me. These could be certain sensory tools like fidgets, or maybe some either noise canceling or noise reducing headphones, or maybe some kind of like instrumental or calming music to help a kid regulate and calm down. Maybe a quiet area that they could go to. Alternative seating, so that could look like maybe cushions or like a little like pillow or wobble seat that they can move around a little bit. We talked about some sensory challenges where kids constantly want to move, and those options for alternative seating allow some of that movement while still engaging and staying in the seat. And that can be as simple as like a little cushion, or having like a kind of like a rubber band or like exercise band around the bottom of the chair legs where they can fidget their feet and play with that. Allowing movement breaks, so that's a great thing. All kids want to move, but some kids more than others. And whether that's at the beginning of an activity, movement breaks in between, throughout the activities. Kids learn best through movement, so engaging movement throughout learning activities could be great too. Reducing overstimulating sensory stimulus as much as possible. So some, like we talked a little bit about before, reducing some like really loud music or noise, bright lights, maybe spreading people out so they're not crammed in together and overwhelmed with crowds, things like that. And then another option could be having like a calm down plan toolkit, or even a calm down corner. So this could be a section of the room where you have certain sensory toys, weighted blankets, or some of those other tools we talked about, to have like a kid can initiate on their own. Hey, I need to go calm down. Like I'm feeling overwhelmed. I'm gonna go sit here for a minute. It's still close enough to engage in the activities. They're not completely isolating themselves, but they're off to the side enough that they can regulate and calm before it results in more of a meltdown. So some things again with transitions, obviously this is a big one because it's talked about frequently. So some sensory ideas with transitions, make them fun. We talked about movement, so animal walks. Hey, we need to go down to this next classroom down the hall. Who can crawl like a bear, or who can hop like a frog, or those kind of things. So make it fun. Who can race the fastest, that kind of thing. Another option is singing. Sing some songs while you're moving from one activity to the next. And then especially things like songs with non-preferred transitions or activities. Everybody knows the cleanup song. Nobody likes to clean up, but when you start singing the song, kids get more engaged. One thing that we haven't done it in a while, but using with our son, he liked Daniel Tiger, and in one of their episodes, they have a bedtime routine song. So a lot of kids have a hard time winding down for bed and things like that. So they have a bedtime routine song. And so it's a catchy way to know, hey, this is what I'm expecting. Okay, I did this. Now I need to do this. Okay, I can do this next. So things like that. And then I wanted to cover a little bit about timeouts. So while they can be a useful tool, they can also be overused or used in the inappropriate ways. So one important thing to do could be focusing on time in instead. So talk a little bit about the purpose of a timeout is to remove a child from a situation where they're misbehaving. So usually placed in a quiet, separate area and then usually with the intention of calming them down and allowing them to reflect on their behaviors. But this can be sometimes perceived as a punishment, and it may also increase the emotional dysregulation, and then it does not address the underlying issues, so certain like emotional regulation. So transitioning to a time in would be more in order to provide support and guidance to a child who's experiencing strong emotions rather than punishment. So this could look like a caregiver or teacher or some other kind of aide sitting with the child, or having them be with them and help guide them along, and having them, it could also be utilized as like a, hey, this is my buddy that helps me gather the tools or whatever, but I'm going to sit next to them because they need some extra support. I'm still going to teach the class or whatever it is, but I'm going to give this kid a little bit more support because they need it, rather than, hey, you need to go sit in the corner because you're not acting right. So there we go. Okay. So I want to cover a little bit about some de-escalation strategies. So once a kid's already having those big behaviors or tantrums or whatever it may be, some important points are to remain calm. Again, like I mentioned earlier, don't try to match their level just to be heard. Again, that can lead into some screaming and back and forth that isn't helpful at all. And again, back to the providing clear instructions. Don't give too many instructions because that can be overwhelming too. And a big part of this is once a kid is already in this dysregulated state, they're not going to process instructions. They're not able to listen clearly and engage. It's almost like the fight or flight thing. It's like they're dysregulated. They're not in control of their body, or they're having a hard time controlling their body. They're not going to listen very well to big instructions. So being aware of your body language, so making sure you're not being aggressive, threatening, or controlling with your actions or with your body. Not hovering over the kid and kind of being intimidating. Get down on their level, squat down, sit down with them. Avoid unnecessary physical contact. Sometimes that, like we talked about with the sensory processing, your tactile system, some kids, even in a regulated state, have a hard time tolerating that touch. And then especially when they're having a hard time with these emotions and dysregulated, they're going to be even more hypersensitive to that touch, and they may react even more aggressively if touched. Validate feelings, not the actions. We already talked about validating feelings, but the next point, set clear limits. So both of those could sound like, hey, I see you're angry, but we cannot hurt other people. Like we have to set clear limits, like, hey, I understand that person did something that made you mad, but we cannot do that. And just being clear about that and making sure we set clear rules. Offer choices when available, and this gives the kid a chance to feel a sense of control, some autonomy. They know, okay, I could do this or this. I get the choice to do it. I'm not being constantly told, hey, you have to do this, 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 and this. And then they react negatively to being told what to do. They get to say, oh, okay, I get to choose now. And so this could be like, hey, I'm offering choices that I want. Like, do you want the blue plate or the red plate? Or do you want to shower then brush your teeth, or brush your teeth and then shower? Like, which one do you want to do first? Or things like that. So offering choices when available. Ensuring safety. There are some times where some of these aggressive behaviors can get violent, and we're going to make sure that we are keeping the child and others around them safe, so be sure to do that. And then address some basic human physical needs. So like we talked earlier about the interoception, some kids might just need some water. They just need to cool down. Maybe they're hungry. Maybe they just need to rest. Maybe they've been exhausted from all the activities at camp. They just need to calm down and go take a break. And then providing some calming tools once they're a little bit more regulated, and then offering those. Another important part is to recognize your own limits. So knowing when, hey, I can't handle this, I need somebody else to help. Not being afraid to do it, not being afraid to say, like, either I don't know what to do or I'm exhausted and I can't do it anymore. Like, sometimes, I mean, being a parent, like, I know all these tools and I'm like, sometimes I need to tap out and I'm, Addie, can you come in? So knowing your limits, whether that's your certain skills or knowledge or just physical needs of, like, hey, I'm tired, I need some help. Because if you push past that, sometimes that can, in the same way a kid can become dysregulated and have those emotions and behaviors, like you can, as the parent or counselor or teacher or whatever, when you're getting tired or exhausted or you don't know what else to do, sometimes that you default to the easy things, like, I'm gonna yell at this kid to listen and obey. So knowing when you, hey, I need to take a break myself. So some best practices, just kind of a summary of some of the things we've talked about. Be consistent, so back to the routines. Familiar faces and routines help kids feel safe. Be flexible, adapt activities when needed, modify or downgrade things. In a way, pick your battles. Some things aren't that necessary, like maybe we don't have to do it this time or like right now or in this way. Maybe we can change it a little bit. It'll be all right. Focus on a child's strengths, not their weaknesses. This is also a big deal when talking to parents. So I'll give an example of, like, a teacher talking to the parents after class at handoff. Hey, your kid was struggling with this, this, and this. They know what their kid's struggling with. They don't want to hear it again. So focus on, hey, they did really good helping with this, or they were full of energy to help with this. Sometimes rephrasing things in positive ways. But it can be embarrassing as a parent or a caregiver, and that can also push people away and make them not want to come back, whether that's Bible class or wherever. So just be aware of how you word things. Another thing, partner with parents so they know what works. They have strategies at home that are helping. I mean, they may not know what works. That might be part of the problem. But in general, like, they have some idea. They've been with these kids for a while. And then a couple ideas with that, possibly on like a registration or sign in for these events, camp or VBS or whatever. Maybe including a section of, like, hey, the parent can fill out a, hey, my kid struggles with this. These are some tools that help. Just giving an idea and a opportunity for the parent to communicate a little bit better with the teachers so you're kind of on the same page and know what to expect. And then again, very important, respond calmly and supportively. So I want to end with a wonderful picture that we have posted on our fridge. So a dear friend of ours has a child with autism, and we were watching her for a while her mom was out with some kind of appointment or something. I can't remember. But she was at the table and had this picture in front of her with a container full of markers, and then we weren't really paying attention too much at that moment, and we just hear some markers thrown across the floor. So look over, there's like 6 markers just being thrown, just over and over. And so walk over there, and then me as the OT and trying to problem solve everything and figure out why things are going on. I notice, oh, maybe she's she like briefly touches the paper with the marker, has the lid on it, doesn't write, she throws it. Okay, maybe she needs some help opening it. She has some trouble with some fine motor skills, so I hold one end, she pulls it, scribbles for a little bit, and then throws it. So then we did the same thing and then focus on hand to me, and then so she scribbles a little, hands to me, and then we transition to putting it on. And so just recognizing like, hey, she may just like throwing things, so that's some kids just like doing that. So, but knowing like there may be a reason for why the kid's doing that. Maybe that's a physical reason, maybe that's an emotional reason. She's getting frustrated that she can't do this. I'm just gonna be upset and this one's not working, I'm gonna throw it. So I just like that example. But some points to conclude us for today. So every child is created in the image of God. Church should be a place of belonging, not just behavior management. And then encourage continued learning and grace for both the kids, families, and volunteers. None of us are perfect. We're all going to mess up. But it's our job to continue learning, to keep trying to learn better ways to do things. So I wanted to, I think that's the end of it. Yes. Open up for any questions, comments, any thoughts? Yes.
In your experience, so a lot of what I think when I think of children's ministry is little kids, but there are also bigger kids with behaviors like this.
Mm-hmm.
Something that comes to my mind that I feel extremely ill-equipped is when like a larger kid, I mean like bigger elementary, middle school, is having an aggressive behavior. And it looks different depending on your context, but what's making that person safe? Because my gut reaction is to get my hands on them and sit them down or, whatever, but that would escalate if they were becoming really aggressive.
Mm-hmm.
You see that with neurotypical people in law enforcement and at the hospital. It's like you don't sit them down. So with a child, I'm thinking children on the spectrum. What would you recommend for like, I've got a middle school kid who's clearly having like a meltdown that's becoming really physical. Is there like a triage way to make them safe where they are? Do you move them? Like, I don't know what to do.
Yeah, so that's a hard one. So what was said was dealing with a larger individual who's having some aggressive behaviors. How do you handle that? So that is a hard one because, like, especially in my field, like, I don't know what the percentage is now, 80-90% of occupational therapists are female. There's a lot of bigger males out there that are struggling with these aggressive behaviors, and so being one of the few males, like, I have more of the, I don't know, requirement to be the one to engage in that part. But that could be like, get a buddy system, have a larger male that's in that system, in that classroom or wherever, not to be like intimidating, but like just as a support and just a backup of like, hey, I know, and that's kind of back to the like, know your limits. Like, I'm not going to be able to handle this kid if he starts pushing and shoving and hitting, like, and we talked about, one of the comments she made was about like putting your hands on him and like trying to de-escalate and like keep them and other people safe. Like, sometimes that can trigger even more reaction. So having kind of having that spot where maybe we go take a walk or something like that. Like, that might be more of an appropriate situation for that. It's like, hey, let's go take a walk for a little bit. Let's go find a different environment, something a little bit more calming, or distract from whatever situation or sensory something that's causing this. So
Having a plan sounds like, yeah, not reacting.
having like 3 plans, so because the first one never works. Any other questions, comments?
So I think specific to like camp, and you got interaction we're having with kids in the church environment or like this, like, what is our real goal? Like, are we really trying to fix their behaviors? I don't think it is.
No.
Right? So like, I think having a clear
Yeah, so the comment was the real goal of this is not, kind of like I mentioned in this, the in the end of it, well, I think this might scroll back. Yes, perfect. So the church should be a place of belonging, whether it's in the church, camps, VBS, whatever. We're not trying to manage and perfect every behavior. It's a place of belonging. It's a place of involving in some spiritual development. And so whatever option we have to take to best support that is the real goal. So again, not trying to fix a child. This is what you have to do, and this is the best way to do it, but just keeping that in mind of like, why are we really here? So
Just to tag on to that, it's not always about what we're able to do for the kid, but if we're able to support the child enough for the parent to be able to have that time to worship, to learn more and whatnot. So it's not necessarily only the kid, but also supporting the parent.
yeah. So for those of you who weren't able to hear, it's not only about supporting the kid, but supporting the kid in order for the parent to have an opportunity to grow themselves. If a parent is struggling to manage their kid and isn't able to pay attention to class or engage in whatever activities in the church, then maybe our job might be, hey, we can support that parent. And that should be our job anyway, is just to support each other. So if we see somebody struggling, offer a hand. And even if you don't know a tool or a skill that would be helpful in that moment, just being there to offer some support.
And also like keeping them in the classroom as much as possible and not just be like, sorry they yelled or sorry they're crying.
Yeah. So the comment was keeping them in the classroom or within whatever activity as much as possible. And then within the school system, that's the least restrictive environment, is like having them be able to engage as much as possible without secluding them or interfering with their engagement with others.
And you mentioned it. It is so true. We don't know what kids are going through. As adults, we don't share everything. Kids aren't going to do that. And the first thing we need to do is they have to know they can trust us. You know, and because you don't know if their parents are going through a divorce, maybe their friend has moved away, or maybe they've lost a grandparent. But there's so many things that impact them that we will not be aware of.
Right. The comment was reflecting back to the knowing the demographics and maybe even diagnoses or whatever a kid is going through that you may not be aware of, just keeping that in mind, knowing that there's a lot going on at home or within the community that you don't know about, keeping that in mind whenever we're interacting with them and the parents, knowing that there's a lot going on out there. So anything else? Yes.
How do you know when they've escalated between the tantrum and the milk?
I'll flip back to that. So this is a hard thing to determine. The question was, how do we know when it's a tantrum or a meltdown, or when it starts out as a tantrum and maybe escalates to a meltdown? And that's not an easy answer, unfortunately. Again, like the slide says, they both present in very similar ways. Often they're both exhibiting the same behaviors. And that comes a lot through like knowing the children. If you've met a kid for the first time, it's hard to tell, like, why are you doing this? I don't know. But if you've been with them for a long time, you might have a better idea. You can look for those subtle cues of like, hey, they're trying to check in with me a little bit, making sure you're paying attention to their behaviors, or maybe what happened right before. Was it like, I told you no and you started throwing things, or I said, hey, it's time to leave your activity, and they start screaming? those kind of things can be clues to, hey, that's probably what's going on. Often more if it's like this came out of nowhere, I don't know what's going on. That's usually more of a maybe some kind of sensory thing or social thing of like, hey, I've been tolerating it this whole time, and now it's just I can't hold it in anymore, and I'm overwhelmed. And so it is very hard, but noticing those clues like before, after, and like what's going on within the environment, why those things might have started.
Can you speak on the hygiene aspect for like when it comes to camp, getting teens and tweens to like without embarrassing them, but getting them to take care of themselves in order to help with the social and
Yep. So the question was talking about the hygiene aspect, especially related to camp. Kids are out there, hot, sweaty, nasty. Kids stink. Kids don't like to take baths. They don't like to put on deodorant. That's just any kid. But some of these kids, especially that are dealing with sensory processing disorders, maybe they have a hard time tolerating the water on their head, and so they don't really like showers. Maybe they don't. Maybe the deodorant tickles whenever they try to put it on, so they avoid it. Maybe it hurts when they brush their teeth, and so they don't really like brushing their teeth. This could also be more of a body awareness thing of some of these. Some kids struggle more with the body awareness part of, hey, I don't really notice when my hands are messy, when my face is messy, when my shirt's undone, or whenever I stink, and just I'm not really aware of it. Maybe I don't smell it myself.
so what are some ways that we can help these kiddos as a group?
So
Especially you, I'm sorry, but we had talked about something.
the question was like, how do we encourage the action of getting these kids to complete these hygiene things, and that's a hard thing. I feel like it mostly applies to camp where we're with these kids daily, but I mean it could be of like in Bible class, hey, you stink, maybe we could go. But in general, having some visuals of like, hey, these are the things we're gonna do, or hey, everybody as a group, make sure we're putting on deodorant. Let's go. Let's do it. All right. And then, or right, yeah. Yeah, the point was not singling them out. So one of the points we talked about was the social demands of like, maybe I'm going to be embarrassed if I get called out for something, and then that's going to make me feel bad about whatever. But maybe right, but maybe presenting it as a group activity of like, hey, we're all going to do it right now. Like, this is what we're going to do, and not, hey, you right there, Johnny, you need to take a bath. So.
Well, and I was just going to address Martha a little bit more on that. Sometimes you recognize things and don't dare say anything like, oh, I shouldn't come in here. 2 years of camp. Do not ever say in front of a child with other kids around what's going on. In other words, well, you haven't showered or whatever, or being out of camp many years, a couple years ago, we had a little girl, and she come from a poor family. I knew she didn't have a lot. It's okay if you don't have the money yourself to do so. I called my daughter, and she went and bought clothes to bring out. It's a little girl on about 3 outfits for a week at camp. If you can't do that, call somebody else in the church. They will. Don't make those children feel singled out.
Mm-hmm.
Dare say anything in front of the other kids.
The comment was making sure we are not singling people out, especially around their peers. Could be very embarrassing. And she mentioned some things about like some of these demographics, people coming from maybe poverty or just like poor home situations where hey, maybe they don't have the supplies for like general hygiene things. Maybe they don't really have clean clothes. Maybe they're not able to take care of themselves very well. And then maybe having some kind of system where we can help provide those things almost, and in some ways maybe even almost like anonymously, so it's not like a, hey, I noticed you have this problem, I'm going to give this to you, because then that just kind of is demeaning, and like, hey, I recognized you're less than others, and so things like that.
You know where they sleep needs to get in the
Yeah, right.
We had a situation at camp a couple years ago at Primary Week, where there were camper A in cabin A with counselor A left and went to breakfast. This is little kids week, not high school. That's a different scenario. And then counselor B went over to camper A, so this is not their camper, and said, "You're out of dress code. You need to go change." And it's like an 8-year-old little girl. Which is inappropriate on like multiple levels, because your counselor gatekeeps, and I'm not in charge of another camper when it comes to like their clothes or did you make your bed, you know what I mean? It's first of all just not appropriate, I think, to look at a 9-year-old little girl and say you should be self-conscious about the length of your shorts, go change. But more than that, not because there's a right and wrong necessarily, but those kids don't get to pack their clothes, and they're all coming from different homes. And so it's that counselor's job, who's built a relationship with that child, to say, let's look and see what you have for the week. And if that's it, give them, like what you're saying, a dignified solution that's not humiliating, that also doesn't cause body image and guilt on a 9-year-old, 8-year-old little girl. But that's just a really good point about like, that counselor is in charge of meeting those needs. You don't cross those boundaries. A stranger counselor pointing that out. I think something I need to do a better job of, I'm going to be a counselor at Primary Week this year, is knowing a little bit about each kid and their context to the extent that I can, whether that's their special needs, a home situation. Maybe everything's great at home, but they just wet the bed for no reason. You know what I mean? Like whatever it is. A resounding theme I'm hearing is like being proactive, not reactive to children, planning ahead for them, planning accommodation in advance, knowing them a little better. I've not done a great job at that, so that's something that I'm looking forward to doing differently.
Yeah, absolutely.
Go ahead and rephrase that. Really.
So Amber talks a lot. There you go. So in general, talking about knowing your boundaries, knowing when to step in, when not to. She gave the example of like one counselor talking and like correcting another camper that was not under them. So maybe a better idea would be, hey, I'm going to go to that person's counselor, and then they can address it themselves, rather than me saying, hey, I noticed you weren't doing that, and they may be like, I don't know who you are. So
You have a situation where there's a meltdown or a behavioral issue that's public in front of this child's peers, and now it's caused some embarrassment or some social friction. What are some ways to talk to the peers about it that's not embarrassing, but also, just trying to get ahead of it before they start picking on them?
yeah. So the question was, when a kid is having a meltdown or something like that, and other peers are around them, how do we address that situation to the peers so we can better explain what's going on, avoiding embarrassment, avoiding negative views of that child, things like that. And that's a hard one too. The best way to up to a certain point, kids will understand if you just clearly explain it to them. Hey, they're having trouble with their emotions right now. He's having a hard time with, if you know what's going on, he's having a hard time with the loud noises in here, or he's having a hard time with this, or something like that. Like, we're gonna give him a minute, and they can join back whenever he's ready, or something like that. But sometimes just clearly explaining, like, hey, this is what it is. Like, sometimes, and even if you want to like give some like perspective taking, like, hey, sometimes we all struggle with this, like right now he's struggling with this. Like this is something we all deal with, and just kind of like broaden it open. It's like it's not just that person. Like we all struggle with this sometimes. Yeah. Go ahead.
One of the things that I try to take with Tim taught me even about with aviation is he said there are rules that we do have to follow for safety.
Mhm.
But then there also becomes you can go off a little bit from that rule as long as you still stay safe. I think, we have rules and things that we follow for VBS, for camp, and everything. But it's not hardcore like necessarily making somebody sad like they wear clothes or something like that.
Yeah. What she mentioned was there are certain rules, especially like out at camp and things like that, where like, yeah, we have to follow these rules for safety or whatever reason. But there is a little bit of flexibility. Maybe we can do it a little bit differently in order to best address the needs of each child. And that kind of goes back to these de-escalation strategies of like, set clear limits. There are some things that we have to follow, but then offer choices sometimes. Like, we have to do this. Do you want to do it this way or this way? We need to make sure we follow these things here, but then the last thing we do today is up to you. Like that kind of thing. So, go ahead.
So I know that we touched on a lot about more with the children that have the meltdowns openly, but what about the ones who are more of the avoidance that shut down and wouldn't really want to engage as much? How do we know when we're pushing too much for them to be part of the group activities?
So the question was addressing more of the ones who are avoiding of things and having more of a hard time engaging. So finding what does motivate them. Sometimes it can be whether it's like anxiety or the social pressures of like, or sensory reasons why they're avoiding things. And it's hard to motivate or get those kids engaged. But maybe finding those like modifications or alternative ways of like, hey, I know you don't want to do this group activity, but maybe we can help them set up for something and you don't have to be engaged as much. Or maybe, hey, I know you have a harder time like with like anxiety or something like that. Like I know these kind of things make you anxious. Maybe we can talk about it a little bit before, like knowing what's coming. And so that's kind of the back to the like routines and consistency. Like some kids have a hard time like knowing what's coming next, but like kind of pre-teaching like, hey, this is going to happen. You can kind of prepare for this a little bit more in advance. So that gives them like kind of that. I know how to better prepare my mind or body or whatever for this activity, and maybe they'll be able to engage a little bit more if they know what's coming or know why we're doing something or have a little bit better understanding of that. Did that answer your question? Okay.
I think in a lot of ways it's nice that society is moving along here, but it's okay for people to be introverted and not much of it. There's this feeling that kids have to get in there and feel. There's kids that just aren't wired like that, and the push to make them do that makes them feel even more awkward when they kick back in themselves. So they just there's some activities we're just gonna have to do. You don't have to be as engaged in them though. Like really just set realistic expectations.
Right. The comment was being okay with introverted kids, and like that's an okay thing. Like kids don't have to be as involved or motivated to engage with everybody or excited to do the group activities or whatever. Sometimes we may do things a little bit differently, and it's okay if you don't engage as much, as long as you're here. And kind of back to the point of like, what's the real purpose? Like, we're here to learn about God. We're here to grow spiritually. If I'm forcing you to do something you don't want to do, that might push you away from wanting to be here. That may push you away from learning anything because you're either really anxious about something or just kind of completely shut down. But finding ways to adapt to different personality types and different needs.
You're not sacrificing your authority in that. Like, they still need you to be the authority figure. You just don't have to crush them. You know, like, yeah.
We also need you to be the example, because I mean, a week at camp is rough. Even a week at VBS is rough. Even, let's be honest, daily life is rough. But get in there and get involved in things too. Don't sit back on the sideline and say, well, all the kids have to participate in this. Adults need to participate too and be the examples.
Yeah. The comment was making sure that you're being the example, and that's a big thing of modeling these behaviors. If you're just kind of, like she was saying, sitting on the sidelines and saying, hey, you got to do this, you get out there and do it too. A kid's going to have a hard time seeing an adult that's like telling me what to do, but I've never seen them do it before. I don't want to do it. They're not doing it. Why do I have to do it? That kind of thing. So.
More experience with older kids or senior week, but man, if you can really equip and empower other kids to be aware, say, hey, be on the lookout for someone who's kind of standing off, and get them involved. Like, they'll listen to them 10 times more than me. Like, they get involved. Like, no, old man, get out of here.
Yeah. The comment was kind of having more of a buddy system, encouraging some of the other kids to be on the lookout for someone who may be struggling a little bit more, and maybe them who have maybe a better relationship, or even just being the same age can have more of an impact on them, encouraging them to get involved rather than coming from an adult, something like that. So sometimes just having that peer modeling and encouraging some more extroverted kids sometimes say, hey, be on the lookout for those kids, and not try to overwhelm them, but see what you can do and ask if they want to join, that kind of thing.
I've seen that in Rosemary is our 3-year-old, and I've seen that in her Bible class where her friends Jamesy and Lainey and Lindley will go, and even Dottie, and there's a bunch of other kids. It's a big class now. They'll go and they'll see she's off by herself doing something. She's not lonely, but she, even if she isn't making eye contact, she sees the people come sit and parallel play or play next to her. She can't play with them. We're learning that, but it makes a difference. There's creative ways to make kids feel included without forcing them into to be included, you have to do the exact same thing the exact same way. It's presence gives that inclusion. If the only way Rosemary could be in her class was if she was able to do the same things the way everyone else was, she might never be in class with her peers. And it's so encouraging to see these little 3-year-olds to see, we can't do things the same way, but I'm glad she's here. And they just go and be with her. And so teaching kids and modeling the children, just go sit on the floor by your friend. She's still your friend even if she can't tell you that, something like that. What
Yeah.
Jeffrey's saying too.
Yeah. Amber talks about being encouraged to see some peers engaging with her daughter, even if she may not be interacting as much with them, but just be encouraging and explain things to your own children of some of these things. These are what some kids struggle with. We can still play with them and we can still interact with them. They might not play the same way you do, but we can still do our best, and we can still be kind, and we can still share and all those kind of things. So yeah, just like she said, just get down on the floor with them and have the kid play with them. Anything else?
Well, thank you so much, Tyler. This has been so helpful.
Thank you.